area of interest I wanted to emphasize is we're really trying to make things personalized for patients, for families. One size doesn't fit all, especially in autism, because we know that autism has a lot of heterogeneity, meaning you might have heard the phrase, when you see one kid with autism, you've seen one kid with autism. In other words, everybody's different. And we want to be careful to not say, well, we're going to give this drug or this other treatment to everybody. And we realize the more specific we can be with what's going on with the biochemical and the genetic profile of a particular child or a teen or adult, the better our treatment plan is going to be. So the work I'm going to be presenting at the meeting is going to focus on how, when we do our genetics and we identify specific genes or different biochemicals that are, let's say, related to melatonin production, for example, it's really important to correlate what we find with what's going on clinically. In other words, if a patient has normal sleep and they happen to have autism, but they sleep really, really well, they go to sleep on time, they sleep all night, they don't wake up, their genes, their genetic profile is not going to be super helpful in terms of identifying treatment. Well, it would from a control standpoint. You'd be able to say, okay, whatever's going on with this patient genetically is good. But if you find some mutation in that individual or that group of individuals who are sleeping well, or you don't actually know how they're sleeping, you're just doing genetics on a large group of people on the autism spectrum, you're not going to learn as much as if you actually say, okay, here's a group of people who have autism and have trouble falling asleep. And here's another group of people who have autism and sleep for 4 hours and then they're done. And then here's another group of people with autism who sleep really, really well. And then if you find differences between those groups, that's meaningful. In terms of the genetics work, one of the things we're doing at Vanderbilt Medical Center in Nashville, Tennessee, where I work, is we have a large collection of medical records. So all the people who come to Vanderbilt for their healthcare, and we can collect in that medical record collection a lot of diagnoses, a lot of information, clinical notes about the patients, lab tests, problem lists, what medicines they're taking, and all of that can be combined with genetics. So the way it works, let's say I come to Vanderbilt for a doctor's appointment and I need to get my blood drawn for some level, like a complete blood count or an iron level or whatever. The part of the blood that isn't used for my lab test that would normally be thrown out is actually banked in a biorepository. And that biorepository is subjected to genetics. So what we can do with that biorepository is we can actually be able to, in a we call it HIPAA compliant, de-identified way, be able to show, for example, all the people with autism who came through our clinic, these are their sleep problems. This is who got melatonin. This is what happened when they took melatonin. Their sleep got better or whatever. And we can link that to their genetic profile. And that's pretty exciting because that means we can have not only large numbers of patients that we study, but we can actually understand what's going on with their sleep. As I mentioned a few minutes ago, we can figure out, are they having sleep problems? What are those sleep problems? And that's how we're going to get a personalized medicine that really treats the individual rather than saying, here's a drug, let's just try it on everyone.